So it's been a really long day already today. As many of you who've been following M.E Foggy Dog will know. But I said that I'd come online live and talk about the work that we've been doing at Stripy Lightbulb in collaboration with M.E Foggy Dog. I work with Bedford Severe M.E. As you will all know, we are an online training platform. We train professionals about what ME is, and we use every opportunity we can to help educate or start important conversations that will lead to the education of healthcare professionals, teachers, employers. So in the last couple of weeks, we've been running a survey for healthcare professionals, HCPs, to participate in. And we were literally asking them a range of questions about remote care and how it could be improved, and to reconcile the mismatch between what ME patients need from a hospital setting and what the NHS can offer them. So in the past few weeks, it was these 5 questions. What makes remote care feel unsafe or professionally risky in your experience? What would help you feel more confident and supported when delivering remote care to severely ill patients? Are there examples from other conditions or services where remote care is safely managed despite limited face-to-face contact? And what practical steps or safeguards could help reconcile the safety needs of both patients and staff in remote care? And finally, we asked for any other thoughts and suggestions. We received 3 responses. And I should just say, we've had increased social media reach of over 2,000% for the past 2 weeks. So I was thinking that we might have had a few more responses. We've also uploaded it to various ICB forums, NHS Futures, you name it. We've had it everywhere. So 3 is a little bit disappointing, but there's nothing I can do about it. So, you know, that's fine. And I should just say, I'm incredibly grateful to all of the professionals who took time out of their day and used their energy to do well, it's supposed to be a 4-minute survey, but I think it takes about 7 or 8 minutes. According to the data that I looked at earlier, it took about 7 or 8 minutes for people to fill it in. So I'm grateful for that time. So thank you. Unfortunately, the sample size is too small and it isn't sufficient to form a representative report that I was going to send to the Department for Health and Social Care and or NHS England, and it just doesn't provide the weight needed to influence national policy. Because, you know, if you were doing anything and you only had an N3, it really wouldn't add a lot of weight. And I got the impression that the 3 people that took part possibly already have a lot of knowledge on ME, so it would have swayed things. Anyway, I mean, that's absolutely fine. It's not a criticism. It's just you know, I kind of hoped that I'd have someone that was a bit, I don't know, that didn't know anything about ME, didn't understand why severe ME have such heightened needs. But I didn't get that impression from the 3 people that filled it in. So just from the responses. So anyway, but I did upload a teleprompter, just the first time I've ever done it, and it's not working. So if you see me reading off a screen, my ME brain today means I can't pretend that I'm not. So, however, even these few responses highlight a critical issue. Remote care for severe ME is perceived as professionally risky. We knew that already. Healthcare professionals expressed concerns about clinical uncertainty, lack of physical assessment, and the absence of clear protocols. Because I think if there was an NHS protocol that they could follow, they wouldn't feel so at risk of doing something that they shouldn't be doing. Because often, I mean, as an advocate over the past 11 years, I've seen posts and talked to healthcare professionals so many times that have said, I could tell that this is what I needed to do, but I couldn't do it because it went against my hospital's policy of doing X, Y, Z for everybody. So there is a need for a protocol, and that links to the work that Stripy Lightbulb has been doing for about 3 years now. So They also shared ideas for improving confidence, such as specialist training, digital tools and structured support. This work is crucial, and we consistently see a disconnect between what people with ME need from hospital settings and what healthcare professionals feel able to provide. The result is a system where remote care is underused or avoided, not because it isn't needed, but because it feels unsafe. For patients with severe ME who often cannot attend appointments in person, this shows a massive gap in care and it can be devastating. Stripy Lightbulb CIC will continue to explore this issue, expand our data collection. Not entirely sure if I'm going to do this survey again. We'll see, because it was an awful lot of work to try and get people involved. And I've got ME myself. Where was I? So we would like more professionals to share their experiences. If you've got any ideas on how to do that, considering we've added that survey to every single NHS platform that we have access to, and that's a lot. But yeah, so we will continue to work towards better care outcomes for people living with ME of all severity, but particularly severe ME. Informally, I don't need a teleprompter to talk about this. So today is Bed for Severe ME Day. Thank you so much to everybody that's participated. I think we've raised around £350 now between the two charities that we're supporting, Smile for ME and Cure ME. Is that, we've still got half a day to go yet. It's from midnight to midnight. So if you haven't taken part yet, please do. Every penny counts. ME is a massively under-researched, underfunded illness. I've said this before and I'll say it again. Comparative diseases such as Parkinson's and MS receive a minimum of 16 times more funding annually than our community does. And that's simply not sustainable. Government wants to force everybody back to work, but without treatments or a cure or adequate health care, how is that going to happen? So I would encourage you to take part in Bed for Severe ME. There is a donation link at the top of your screen. I pointed in the wrong direction this morning because on my screen, as I look at it, it's there, but I think that that's my logo. So I'll point over there, even though that looks completely wrong to me. You can donate via that QR code. If not, if you go to stripylightbulb.com, you can access the donation links from there. But yeah, it's been a busy day. I will not lie. You can probably tell from my voice, which is a little bit croaky. It's been an incredibly long day already. So thank you to everybody that's participated, whether that's on the survey or in Bed for Severe ME more widely. But as I said at the start, I am in my pajamas today. It doesn't look like it, just looks like a top. But see, I'm in my stretchy pajamas. And if there are any employers or organisations, businesses watching this, please do know that I want to grow Bed for Severe ME year on year. I'm hoping to beat what we managed to raise last year, and next year will be one step further. But I can't do that without outside help. So if you are outside of our ME bubble, and can help me to get our fundraising into workplaces. I'm literally asking people to wear a pair of pajamas to work as fancy dress, not turn up straight out of bed unwashed in dirty clothes, talking about changing into a new set of pajamas and wearing them at work. And then everybody donate £2. I don't know whether anybody's participated in that today. I had quite a lot of positive rumblings in recent months, but no confirmation that that was actually happening. So if you are able to help with that, please do let me know, because this is a very long-term issue that isn't going to be solved overnight. And that's why it's an annual campaign. So let me know if you want to get involved. All right, thank you very much for listening. Apologies that it wasn't as professional as I normally try to be. Unfortunately, my brain's not working, and then the IT backup wasn't working either. Have a great day, everybody.